Say, because none of you probably have nerve pain, so but for you, let's say if you go tight, so I measure tight in hamstring length like this, 90 degrees. Okay, so here's maybe a bit tight through here, compared to this side. Maybe a bit more. Good. And again, yeah. So which one you feel tighter? So feel this. This is.
Or this side. Yeah.
That's what I thought. Now, if we do this side, so lie down on there, facing me. So like I said, we can do, first of all, we'll pretend that you've got leg pain or nerve pain, so we'll show you that. But then also for what we do for tight hamstrings as well. So what I really do, what is the spine, guys? Somewhere. So what we're doing, so I'm going to again lean on top of a patient, and I'm going to be two thumbs, one on top of the other. Is going to push the spinous process away from pain and hold that and sustain it. So this patient's got this leg pain, so I'm going to push spinous process down towards the bed. Now, the patient, you tell them, look, it's going to be a strong technique. You may feel pain from my pressure of the thumbs. But what I'm interested, if by applying the strong pressure, reduces your leg pain. So you may get, they may feel a bit uncomfortable, especially when you're practicing. But with the experience, you will also feel going to be firm, but also gentle. So, but it takes a bit of time. But alternatively, if they've got very kind of tiny bodies, very superficial spinal processes, it's going to be sensitive, the bone structure. So maybe use like a little sponge or some kind of padding. You can buy a little sponge or All right. So the spine is in neutral. So let's say he's got acute pain at the moment. So again, I would put, can I have another pillow, please? Today? Yeah. And then I get you to, now, so from here, so let's say patient was straight leg raise positive at this point. So I just slightly shorten and bend the knee. So what I'll get you to do, I'm going to apply this pressure. Yep. Maintain this angle. All I want you to do is just come into that position, just to there, and bring your leg back down. Just to there, and bring the leg down. So don't increase anything else. So now guys, so I'll come really on top. I'm almost leaning on top. I find the spinous process, let's say 5. And then see one thumb on top of the other. And I push fairly strong and sustain that pressure down. Now, straighten the knee, and then bring it back. Oh, no, this is still painful. I said, no problem. Come back. Yeah, relax. Let's go to the next level. I find the level above. Push that down. Now let's go. Oh, that's good. So that's what you're looking for at this point. Oh, much better. It's much better. Lock it, hold it, and patient repeats that. We do 3 sets, maybe have a break. 3 sets, have a break, and then 3 sets again. But no more than that, I think, on day 1. Okay, so that would be more for acute setting. If the patient's symptoms are not so acute, maybe moderate or maybe on the lower end, we can progress that. I say, look, actively now, when you can go to keep going until when you start feeling the pain, and then bring the leg back down. So you can do actively now almost straight leg raise. No dorsiflexion, but just going through range. Have you guys tried this before? I really like this, honestly. I think can be like almost magical. Not to all the patients, not talking about persistent chronic complex patients, but from a mechanical point of view and nerve point of view or pain point of view can be very effective technique. So, I again just go here, let's say a block here, let's go. And see as it's going, I'm moving my body, so I'm not blocking. Can you see that? I'm shifting my body weight as well. So he's got free movement. And just relax a bit more. Now we're gonna, because he has no nerve pain but tight hamstrings, so I'm gonna push on another level. You tell me which one feels the best for you. Let's go. In terms of relaxation, the first one that I did or the second one? Second one. Yeah. Patient tells you. And I go by what the patient tells you, but keep going now. Hey, come back. Don't go into a deduction. Keep that horizontal. Okay. And keep going. Don't go too fast. Let's go. Keep going. Higher, higher. Keep going, keep going, keep going, keep going. Yes. and then come back. Maintain that neutral, maintain. Keep going, keep going, keep going. Yes, good. So you kind of have to give them a bit of instruction as well if you see that they're doing something correctly or they're doing a lot of adduction of the hip. You want that sort of horizontal, that keep moving, keep moving, keep moving, good. Okay, and again, keep moving, good. Okay, fine, thank you. Now come back here and just lie down on your back for me. And then we'll reassess. Wow. I told you it's a bit of a magic. Isn't it great? And it's like you feel, yes, I knew that. But it's that sort of it's a bit of a kind of like a party trick almost. But and now you know what to do. You go for a walk, even for the jog, for athletes. Just see how you feel. Just go for a walk and tell me how does it feel in the leg.
It feels light.
Lighter. That's exactly what they say. It feels lighter. So we're not massaging because before competition we don't want to dampen and activate parasympathetic nervous system. But this is a quick release. 3 times, boom. Or sometimes they say, look, I just feel before training I feel a bit of tightness, almost scared it's gonna be, like a strain of a hamstring. That could be a nice thing to do as well. So for nerve pain, but also for muscular kind of tightness a bit, or as well. Nice. I think I selected the right person. Maybe some other would be not so good. It's good when it happens in your video. You say, wow. But anyway, so I like that. So it also gives that confidence to the patient as well. If they see that, it's sort of almost you feel that they almost shifted something in the brain. You can see the chakras open, and then the fountain. It's anything can happen when we deal with human, huh? So, any questions, guys, on that?
So this one is also for compressive neurography and PNS.
That's right, because he doesn't diagnose. He tries, but you do. So I'm not saying that anyone comes in like limping straight away. We go through a subjective examination. We go through that, and then this is one of the treatment options. So I'm not saying yes now. Everybody comes to leg pain, bang. Some improve, some maybe not so much. Okay, so let's try this position. First of all, gentle, and then go test each other's hamstrings, even for the hamstring leg, because you don't have all the pain.